Obviously, when I took office
That's
15
why
months ago,
stay at home.
neither I nor anyone could have anticipated we would be confronting a global pandemic. So today we have to have a very candid and open, important conversation with you. In just 13 days, we've gone from 0 to 1,232 confirmed cases of the coronavirus, COVID-19. It has doubled over the weekend. This virus is spreading exponentially.
Let's go, y'all going.
And in the ordinary situation, if you get sick, you can go to the hospital. We know that the medical team would have the appropriate personal protection equipment like masks and face shields and gowns. They prescribe some medicine and you'd be okay. But COVID-19 is a global pandemic. It's a novel virus. There's no cure, there's no vaccine. The only tool that we have to fight it at the moment and to support our healthcare system to respond is to give them the opportunity by buying some time. And let me tell you why that's so important. We have roughly 10 million people in our state. There is a model that anticipates that if we stay on our current trajectory, just like Italy, over 70% of our people could get infected with COVID-19. Of that 7 million people projected, about 1 million of them would need to be hospitalized. Let me give you a little perspective here. We have about 25,000 acute care beds in Michigan. Think about that. That's where we are headed currently. So stopping the spread of this virus is really the most important tool that we have right now to keep our community safe. That means without aggressive additional measures, more people will get sick.
Hey, no, did you peep how they just scanned away from the black lady? Look on TV. Are you not watching?
Hospitals will be overwhelmed. And we currently don't even have enough beds, masks, gowns, and ventilators. But if we all do our part and simply stay home, we have a shot at helping our healthcare system meet our needs. Because this disease can't spread person to person if we're not out there. So we work together and we take this seriously. We can slow the spread of COVID-19. But right now, too many people are still out and about unnecessarily. So we must do more. Our problem has been exacerbated because we're still not getting what we need from the federal government. Last week, the president's message to our nation's governors was essentially that we're on our own to handle getting supplies. Let me just put a finer point on that. We just received our allotment from the federal government's National Strategic Stockpile. The allotment of personal protection equipment for one of our hospitals was 747 N95 masks, 204 gowns, 4,467 gloves, and 64 face shields. Now, with the exception of the gloves, that allotment is barely enough to cover one shift at that hospital. Not even a full day's worth of shifts, one shift. So while I can't do overnight what the federal government should have done over the course of months in planning, my team and I are working 24/7 to secure the things we need. So far, we have secured more than 4 million gloves, 4 million N95 masks, and thousands of gallons of hand sanitizer, thanks to Michigan businesses, Michigan companies, Michigan distilleries, and Michiganders who are pitching in. And while that's a source of pride and that is good, it is nowhere near enough.
Pretty
Now
good.
is the most crucial time for us to come together to protect ourselves and our families. We must work together to bend the curve. We must do more to curtail community spread so our health system has a fighting chance. Today I'm issuing a stay home, stay safe executive order for all Michiganders, and it goes into effect just after midnight tonight for at least the next 3 weeks. Without a comprehensive national strategy, we, the states, must take action. We are joining a number of other states that have started, and I anticipate many will follow. States like Ohio and Illinois, New Jersey, California, and many others, including New York. We are doing this because it is absolutely necessary to protect the health of our people. The goal here is simple. Stay home, stay safe, save lives. This will be temporary. This intervention is important to buy time so we can create surge capacity in our hospitals, so we can ramp up testing and develop therapeutic drugs that may lower hospitalization and fatality rates. Please know that even with today's action, the number of cases will go up yet today, tomorrow, in the days ahead. It will take some time for us to impact this. We will be continually evaluating the data, the science, the impact on our health. It is going to take greater testing. We've made strides, but we must do more so we can understand what the challenge is that we are confronting. So we can draw conclusions based on data.
She not giving her time.
If it were possible to wave a magic wand and make all Americans freeze in place for 14 days.
No, and what she about to do is cause a mass panic.
She said after midnight.
Right. You can't leave your house. So now it's not a time. Remember, it was supposed to be a curfew.
This order will depend on factors like data on COVID-19 infections.
And it's for 3 weeks, not 2 weeks. So that means as of today, you ain't supposed to leave your house. And that's for 3 weeks. But I told people 2 weeks ago that they was on quarantine. So they went and took all the food out the stores 2 weeks ago. Almost half of that's not been replaced.
I want you to know I didn't make this decision lightly. I've consulted with medical experts from across the country and right here at home. From University of Michigan to Penn to Johns Hopkins to Harvard. Dr. Khaldun and all of these experts recommended today's action. And it is clear this is what we can and must do to protect ourselves. We will all have to make significant sacrifices. By taking this action, we protect our public health and ultimately the hardship on our economy. This is the time we must come together as Michiganders. If we stay home except for essential work and essential needs, we can each be a part of making the difference here. During this time, critical services will remain open. Businesses and operations that do work, that sustains or protects life, can continue to perform that work in person. But in doing that critical work, they must take aggressive steps to minimize the spread of COVID-19 as much as possible. Your grocery stores will be open. I have checked on our whole supply chain for food, and it will be accessible. Do not panic, do not hoard. These services will remain open. Your pharmacy will too, so you can get your prescriptions. Your banks and credit unions. You can fill your car with gas. You can find the full list of critical services that will remain open at michigan.gov/coronavirus. Remember,